Hey guys, me and Annie are back for episode 7, and in this episode we're going to talk about some facts and myths to do with dissolving.
Yes.
So specifically dissolving with hyaluronidase.
Yes.
So let's start actually with the biggest myth of all when it comes to dissolving. Do you know what I'm going to say?
I think you're going to say dissolving hurts.
Yes.
Yes.
You are, right, that's exactly what I
Yeah.
was going to say. So you lead then. I'm coming to you for my dissolving, Annie. My lips are too migrated. I want my lips dissolved. What the first thing they say is, but I've heard it's agony. Yeah.
And it absolutely shouldn't be.
No.
Because when you're doing this, there's different types of water that you can mix the dissolver with. And if you're using Torback water, there is zero pain. Well,
yeah, other than the needle.
Yeah, other than the needle when you're doing this. But if you're using water for injections, that can be, and I would actually say this because do you remember we actually did it once with water for injections?
Yeah.
That was actually up there with one of the most painful treatments I've had done.
Yeah.
So the myth itself is, I guess, comes from, it homes in truth, because if you're mixing it with water for injections, yes, that's painful. However, if you mix it, what I would say, and you would say the correct way with Torback, then apart from the needle, and what we'll probably go into is the needles you can use, and if you use a TSK and Visi needle, there is, I would go as far as to say there's almost no pain.
Yeah, very close. Or you could even use a cannula, which potentially would be even less pain.
Yeah.
But yeah, the biggest myth with dissolving is exactly that. To the point where Annie could read my mind, it's agony. It's definitely not agony. So let's just break down, and I'm sorry if you guys know this already, but let's just break down in the simplest form possible about Torback and water for injections, because there would be people who are very new or people that have not heard this before that would say, oh, well, Torback is a water for injection, which it is, because it's a water that you use for injecting. But when we say water for injections, we're not using a generic term as in Torback is a water that you use for injecting. There is a specific product that's called water for injections that is a non-prescription product, which is why most people use it, because they don't have to pay a prescription for it, and it's cheap and easily buyable. You can buy it on Amazon, for example. But water for injections, even though it is a water for injection, it's not something you should be using with any aesthetic treatment, because for whatever reason, I think it's the lack of salt, I could be wrong, it is agony when you put it in. So like Annie said, so describe the feeling. If I got water for injections now, and I injected it into you, how is that going to feel?
The sensation I felt was, it was like a bee was stinging me inside my lip, and it wasn't a quick, the needle goes in, you inject the product. Let's say you're having a polynucleotides or a skin boost or a Profilo. There's the slight sting where you're kind of splitting the skin when you're injecting. However, it lasted. It would last maybe about, I would say anywhere between, and this isn't me being dramatic, 20 to 50
No
seconds.
way.
I swear I'm not.
Oh my God.
20 to 50 seconds after. And I think in the moment I described it as lava.
Yeah.
So,
well, actually, just to stop you, that is the way that I've heard it described the most. Is people say like fire being injected into you, or being burned with like a hot pin or something.
Yeah, it's horrific. And quickly going off topic, but staying on this topic, I have had a handful of clients that have come to me and they have said, Botox was agony.
That's so bad.
It's horrific, isn't it?
Yeah.
And that's another treatment that is relatively pain-free if you are using Torback, which again, prescription water, that shouldn't be painful at all.
Yeah, so just take this one rule and you can't go wrong. If you're mixing any powder-based product with any kind of liquid in this industry, just use Torback and you cannot go wrong. Yeah, I know Torback is like relatively expensive and I know that you have to pay for it on prescription, but this is the the ethical way to do it. You should not be doing in any other way. There are slight variations on Torbac, bacteriostatic water, etc., which is fine. But the best, most pain-free way to use any of these products is with Torbac. Do not use water for injections.
Full stop.
Yeah, end of. And I don't know if you remember, but we once heard, I don't know if this is true, but we once heard a rumour that in the industry, people were using eye wash.
I knew you were about to say that.
Apologies, guys. The Google thing has just gone off. We heard that there are people using eye wash to dilute their product.
And another one.
Please don't do that, guys.
There was people were boiling water in the kettle and then using it. And can I just say, when we talk about Torbac being expensive, for a 5ml single vial is £3.99 on the pharmacy that I use.
Oh, really?
Then,
per bottle?
Per bottle. So that's
okay.
just if you're buying one vial, but that's 5 millilitres of Torbac.
Yes, that's 5 people.
That's 5 people.
That's 8. Go on, calculate it.
Don't make me calculate it on the spot.
Yes, that's 80 odd p each, 85p or whatever it is. Yeah, that's, oh, okay, yeah, that's even less than I thought.
And then what you say is, and I steal this, so if any of my clients have heard me say that, this is stolen from Adam Matthews. If you don't paint them, you retain them.
That is very true, yeah. Don't paint them. I actually stole that from someone else. But yeah, don't hurt them unnecessarily. For 85 pence.
For 85p.
Yeah, and please don't risk infection and all those other things. And I'm sure, to be honest with you, this is probably a bad subject for this podcast, because if you're going out of your way to spend time watching or listening to something like this, you're probably not that person.
100%.
Yeah, those people, I'm guessing, aren't trying to further their careers listening to things like this, aren't trying to further their knowledge, I would imagine.
Yeah.
So apologies if that is you. That is definitely not that person that doesn't do these crazy things. Yeah. But let's talk about it anyway, because these are industry things that do happen. And for those people that are beginning, who might be listening to this, they may not have heard these things before. Now, onto the dissolver itself.
Yes.
So there's only ever been 3 types of dissolver that I've ever seen. One bad, illegitimate, fake, not fake, but I don't know, not good product. I won't say illegal, but let's say illegal product. You probably won't get arrested for it, but it's not the right product you should be using. And that is the one that is called, what is it actually called?
Liparase.
Oh, Liparase. So it's Chinese, I believe, or Korean. It's got Korean or Chinese writing all over it. It's got a purple lid and it comes in a little tiny box of 10, which you can buy not on prescription. And actually, I've seen it on filler websites that are
legitimate.
Yeah. So just because you see something on a legitimate website that's selling legitimate fillers, please do not use this product for a number of reasons. First of all, it's non-regulated, it's non-approved, it's not got any form of accreditation to it. Secondly, it doesn't work very well, or if at all, which may come down to the fact that the product doesn't work very well, or it may come down to the fact that their quality control means that one vial works and one vial doesn't, for example. But please do not use Liparase. I've had people come to me before who have caused a VO on somebody or are trying to help with a VO, and they've used that to try and fix it, and obviously it doesn't work. So please, especially in the case of emergency, do not use Liparase.
And I think, going back on to what Adam said, where there's no regulations, the concern in a vascular occlusion, yes, would be if it doesn't work, but also because there's no regulations, there is no set guidelines of what this product contains.
No.
So you could not only be risking the delay on dissolving a vascular occlusion, but you could also be risking their life. And we're not undermining this.
No.
It is potentially their life if they were to have
anaphylaxis. Yeah. I mean, the other thing is as well, you do not know the level of quality control when it comes to hygiene. So you could also be introducing infection. Of course. Which we have seen multiple times, really awful cases, not from this, but from fake Botox or fake neuromodulators, or however you want to put it. So please, please, please do not use that Liparase product. buy the legitimate product. So I said there's 3, that's 1. On to the other 2. I've only ever seen 2 legitimate products. Hyaluronidase, which is the actual most well-known one that you can buy from the pharmacy. It has to be on prescription, but it is, I think, do you know how much it is? About £35
I think it's £35 per vial.
Roughly. That could obviously vary significantly, but hyaluronidase is the one that you would be best off using. I've also seen another one called
Dissolvidase.
Yeah, Dissolvidase, which actually comes in a lot more of a chunky container, but you still use it the same way, and it is. I lost my words. It is authentic. It is allowed in this country. It has got approval, so you can use Dissolvidase as well. And actually, I always stock both because sometimes I've had it where I've patch tested someone on one, and then I've had them back a couple of weeks later because they've had like a minor reaction, and we'll talk about patch testing in a minute. And then I've used Dissolvidase and they've been absolutely fine. Now that's not to say that 2 weeks later they wouldn't have been fine with hyaluronidase again, but it does give you that slight alternative. So it is potentially worth having a couple of each, or at least having the potential to know where you can get Dissolvidase from should you have that sort of reaction. But those are the 2 legitimate products. If you guys know any others, then let us know. They're the only 2 that I know. I don't know about you.
They're the only 2. Well, they're the only 3 that I've actually heard of. Yeah. I haven't actually even heard of any other dissolving.
In America, they call it a totally different name that I've forgotten the name of it, and they have different units and everything else. But in this country, the main product is called hyaluronidase, and I say it with the higher because that's how it's spelled. People call it hyaluronidase, but it's spelled hyaluronidase. Yeah. And then a lot of people also call it, let's think of other names people call it. Hyalase, Dissolver. Yeah, maybe that's it.
I think that is.
Yeah, so when people say Hyalase, they're really just shortening the name as a terminology and describing either Dissolvidase or hyaluronidase. So just bear that in mind. There isn't actually in this country a product called Hyalase. I say in this country because it's possible that in America their product is called Hyalase. Maybe that's where that comes from. I'm not too sure. You can let us know if you know. I do know that in America it's got a different name. Normally I remember it, but I can't remember it. But anyway, in the UK, it's hyaluronidase or Dissolvidase. When you mix those, and we'll talk about mixtures as well in a minute, they do not hurt.
No.
At all.
Zero pain.
All you're getting is the needle pain.
Yeah, and if you, like we said, use a Invisi needle or a tiny needle, really small gauge, then, and if you pre-numb, it is
close to painless.
It's close to painless.
Yeah. So let's talk about patch testing. So talk everybody through what your regimen would be, your procedure for patch testing, where you inject, how much you inject, and how long you wait, what you're looking for, those kinds of things.
So when I patch test a client, I will always do it on the inside of their arms, and I'll try and find a landmark that's there. So for example, I'll go for a freckle or a little mark, and you are doing a very shallow injection of a couple of units.
Yeah, intradermal is the key there.
Yeah.
Because when I see a lot of people doing a patch test, they go in under the skin and then they put a small amount, but that's not the point. The point is to be intradermal, so you're inside the dermis, inside the skin, and you should see some form of blanching.
Yes, and what I think is most common, let me not skip forward. So I do that, and I will then sometimes draw a circle around it, maybe 2 centimetres from the injection site, and I will wait 30 to 45 minutes. And when I'm waiting, I will stay with my client.
Yeah, or at least within close vicinity, yeah.
100%. And if there is a slight reaction, that is where you use your previous knowledge or what you've learnt beforehand. We have injected intradermally. There has been an injection site, so it is possible to see some slight redness in the area. If I'm concerned about the redness that I'm seeing, I will go on the other hand and I will inject saline. And I will see if their skin is sensitive to the injection or if it is potentially sensitive to the hyaluronidase.
Or you could do both of those together. So you could do, for example, one on one arm with hyaluronidase, and on the other one with just Torbac. Draw a little circle around it,
Yeah.
and just see what happens. If they both come up the tiniest bit pink and they're very much similar, then I would say that is okay, providing that person has no allergies whatsoever.
Yes.
However, if they do have any allergies whatsoever, I would take a second look at that and maybe do it on a different day or look at it a bit more closely. But it's always worth definitely doing the two. Or like Annie said, do one first, see how that goes on, because in most cases nothing comes up. If that's the case, it's fine. If you do see something, head to the other arm, do a little injection of Torbac and just compare the two. So that's the procedure. Now, what is the biggest potential concern or side effect of hyaluronidase?
So that would be anaphylactic shock. And there is a difference between an allergic reaction and anaphylaxis. So there are people that can have the treatment done and then will show.
Anaphylaxis is a major allergic reaction, but like Annie said, there's an allergic reaction and then there's anaphylaxis. And even though they're kind of one in the same, they're kind of not also. It's entirely possible that they have a relative amount of inflammation, even if they pass the patch test.
Yes.
However, a step beyond that, anaphylaxis, we won't go into detail about anaphylaxis, but you can Google what that would be: hives, shortness of breath, tight throat, tight chest, diarrhea, sickness, puffy eyes, all these different kinds of things. That would be a major allergic reaction. I have seen it where people who haven't had any reaction to the patch test, their lips have gone extremely swollen.
Yes.
Yeah, but they do go down very quickly, and that is not something to panic about. They will go down, and that is not a normal thing that happens, but it's not an abnormal thing that happens. It's not a common thing that happens, but it does happen.
Yeah, reactions have degrees of severity, don't they? And I would always suggest to my client, and I don't know if you do this as well, is if they are starting to swell or if they are starting to show signs of a little bit of a reaction, I'd just suggest antihistamines.
Antihistamines, unless any of the indicators are there for anaphylaxis. Now, obviously, your lips blowing up like balloons isn't really associated directly with anaphylaxis.
No.
However, all the other things we quickly mentioned there, and if you ask ChatGPT or if you go online or go back to your training, you can see a big list of what all of those things are and various pictures. But yeah, they're not one in the same, but also can't be ignored either. You need to be checking in on these people. And I will always say to anyone that I've dissolved, even though if you were to have an anaphylactic response, it would generally be right now, there is always the potential it happens in the future, and that actually in that one situation, if you see any of those anaphylactic type symptoms, you must ring 999 immediately.
100%.
And not contact us. Not to be rude, not to be dismissive either, but because if there are any signs of anaphylaxis, it's very important that they get immediate medical attention.
And time is very important when that happens.
Very.
So if you had a client that came to you for a elective dissolving treatment and they were somebody who has been suggested to carry an EpiPen for an allergy that wasn't directly related to the treatment that you were going to do, let's say for example pets, what would you do in that situation?
Yeah, so first of all, immediately I would have a cause for concern. I personally, in most situations, will only really do Dissolver electively on someone who has no allergies. Mm-hmm. If, for example, they do have an allergy, especially where they may have had anaphylaxis before or risk of anaphylaxis and are even to the degree where they're carrying an EpiPen, I would definitely not do it without consulting the prescriber and having that hyaluronidase specifically prescribed to them and doing every single thing in my power to make sure that you should be doing that and that it's the right thing to do. And the only way you're really going to do that if you're a non-medic is to have that person communicate with a prescriber, with a medic, and make sure that is definitely the right course for them to take. And even if you were to go ahead and it's all been okayed by the prescriber, by the medic, even then I would definitely be sure you have EpiPen, which you should have anyway.
Yes.
2, because that is a child's dose. Preferably have adrenaline on hand in a vial as well, just in case. Also potentially have oxygen. asthma pumps, antihistamines, potentially even intravenous antihistamines and steroids, and even oral antihistamines and steroids. All of these things would be dependent on what the prescriber has guided you to do. But there are things you can do in that situation. But I would be very, very cautious about the route that I took to do that. I wouldn't just be treating them like any other person.
Any other client. No.
Yeah. Part of what you did for them would still be a patch test, obviously,
Yes.
but it would be after the rest of that route, for sure. Yeah. And even actually not even to do with hyaluronidase, to do with any treatments, because you can be allergic to hyaluronic acid. Very unlikely, but you can. You can be allergic to the lidocaine that's in the filler. So if you do get people that on their consultation form have written that they are someone that suffers with one or more allergies, you really need to be looking more closely at exactly what's going on and contacting your prescriber and having a good consultation, maybe even all three of you, before you consider moving forward. I can tell you from experience that anaphylaxis is categorically the single worst part of what can happen in this job, more so than VO. So please, please, please be hyper educated on anaphylaxis, be hyper aware, be extremely detailed on your every consultation regardless, and make sure that you're doing the right thing to avoid anaphylaxis.
And I think something that isn't directly related to this but is, I think a lot of people with consent forms and consultations now, they have this illusion that as long as the client has signed it, then they're good to go. And I think with things like FACES consent, so they will respond back to you, I am aware of a significant amount of people that just because their client has sent it back, they then don't go over it. And I think that is really important, because on that consent form that your client has sent you, it is then up to you to review that, because that consent form then could say that not only have they had anaphylaxis before, but potentially they might have had it to latex, and potentially you have latex gloves, or they could have had it to aloe vera and you're using an aloe vera cream, let's say, after. These kind of things are so, so, so important, because something as simple as potentially not checking that one client's consent form after the treatment, prior to the treatment, could have very detrimental effects.
Yeah, and like Annie said earlier, there's a big difference between like a minor allergic reaction and anaphylaxis, but it doesn't mean that we only care about anaphylaxis.
No.
If you use, for example, a product, cream, glove, whatever it might be, on that person that said that they have a bit of a, an allergic reaction to it, and it's not as deep as anaphylaxis, that still doesn't mean that it would be very upsetting for them and very anxiety inducing for you if they're carrying around a rash for the next week
100%.
because you've used something that they've clearly said that they're allergic to. So yeah, like Annie said, we've always stipulated consultation is ultra important, much more important than most people think it is, because clearly most people don't do it.
Yeah.
And secondary to that, aftercare as well. And in fact, we'll do a whole episode on both of those, because we do think that they're that important.
Yes.
And actually the aftercare specifically is where you're going to be sure that they know why and how to contact you. And the consultation is your education. In the same way that we need to be educated to a certain degree, they need to be educated to a certain degree, and that is your chance to do it. That's your chance for them to educate you on their personal health situation, and also for you to educate them on the procedure and how it works and everything else that goes alongside it. So we won't turn it into that, but these things are super important.
So essential. I would say it's as or more important than the treatment itself.
Yeah, so let's quickly talk about potential adverse effects of hyaluronidase and why. So the first thing to understand is the reason that hyaluronidase is potentially anaphylaxis inducing or even just reaction inducing is because it is an animal product. So the vast majority of hyaluronidase is harvested from, I know this is funny, but harvested from the testicles of specific animals. I think the majority of it is goats, but I think you can also use pigs and cows. So when you're physically putting an animal product inside somebody's body via injection, they can react to that animal product. So that is the reason why. The actual reason it comes from the testicles of these animals in the first place is because the enzyme hyaluronidase itself is utilised on sperm to enter the egg, the female egg. So female eggs have a huge coating of hyaluronic acid. That's how they store water, which obviously they vitally need to stay alive, but they're also a solid object. So in order for the sperm to penetrate probably not the most appropriate word, but it is the right word, to penetrate the egg, the tip of the sperm is covered in hyaluronidase, which enables it to permeate the egg, get inside and do the job that it needs to do. So that's where that comes from, which I think in itself is just the most incredible story.
I think it's incredible.
Wow, whoever thought all this stuff up is clearly insanely smart.
Yeah.
So, but that is the reason that it can cause an allergic reaction, is purely because it's an animal product. Not specifically because it's from the testicle.
No, not just for that reason.
But because it's an animal product. Now, if you were to patch test, inject, and it's all okay, but you see signs of anaphylaxis, we won't make this long because this should be quite a large piece of your training, but what is essentially the protocol, the short term of the protocol?
So what you would need to do in that situation is, if your EpiPen is prescribed to yourself, you would ring 999. You would say to them that you have a client on the bed who's showing signs of anaphylaxis. You have an EpiPen prescribed to yourself. Can you administer it? If your client is somebody who, like we said before, that does carry an EpiPen and they have their own, and you have spoken to your prescriber and you have gone through with it and you have theirs, you would use theirs. When you're using an auto-injector, you can go through clothing. However, I would advise not to. And when you are injecting that, you need to hold it down onto the area you're doing it. And I actually would always go for the thigh.
Yeah.
If I'm doing this. And you want to hold it down and you want to hold it there for 10 seconds. And an average EpiPen has 300 milligrams in it. You want to hold it there. You're going to click the button and you should wait about 10 seconds. Once you have done that, you should see signs of automatic relief from the client.
Like instant improvement.
Instant. They should be able to breathe easier. Their hives should be not necessarily gone, but they won't be getting any worse or any more aggressive. And they should seem like they are coming a little bit more, I know this isn't the best phrase, but back to life.
Yeah, and one thing to bear in mind is as well, the chances of you ever actually having to administer an EpiPen are slim, because in order for you to do that, they would have to be in a very dire state.
Dire situation.
Anything outside of that, so for example, a little bit of shortness of breath, a little bit of swelling around the eyes, a little bit of anything, it's going to be 999 ambulance hospital, or 999 and they're going to take you to tell you to take them to hospital. The chances of you actually administering an EpiPen are actually fairly slim. The chances of them having a reaction are also very slim, but if they do have a reaction, the probability is that it's going to be enough that they would need to go to hospital, but not enough that you would need to administer EpiPen. Yeah. And what people don't understand is, when someone does have a much more than an allergic reaction, but not full EpiPen required anaphylaxis, that is not a short-lived thing. They're going to go into hospital, they're going to have potentially steroids, they're going to have potentially adrenaline, although very unlikely. They're going to have potentially antihistamines, or very likely antihistamines, and their symptoms may roll on for a matter of weeks, not instantly fixed. So do bear that in mind. To me, the single most dangerous, awful thing that you can go through in the aesthetics industry is not VO, it is anaphylaxis. Even a minor case of it, because I've seen a minor case that has dragged on for weeks and weeks, required multiple hospital visits, never life-threatening, but really like life-altering to their day-to-day routine. So please do bear that in mind. And you know, before you go willy-nilly administering hyaluronidase, you should really think about the fact that it's not a freebie. It's not like, oh yeah, just chuck it in, it's only dissolver. This stuff requires massive consultation, massive thought, and you know, a good even conversation potentially with medical people to make sure you're getting this absolutely right and should not be taken for granted at any stage.
And it inquires you to make sure that you are, as an injector, at your correct capability, because you need to make sure that you have an EpiPen, that your EpiPen is in date, which is something that is important. However, we have been informed before that even keep the out-of-date ones, because there is a chance that that could still work if administered, but that would be
only though if you've already used your two in-date ones.
Exactly, that you are prepared for that outcome, because I know that we've had people on courses before and it is first day we're talking about this and they're like, I don't think I'm going to want to work on somebody's previous work. I'm going to want to dissolve people's previous filler so that I can have a fresh canvas. And that isn't the way to start off when
unless it's really kind of getting to that person or upsetting them or something like that. It shouldn't be a first response to everything.
No, it's not like eyelashes where people don't want to work on people's previous work. It's not like that. If it's not really an issue to your client, it shouldn't be too offensive to you, I don't think.
No, and also do bear in mind as well, even in the case of emergency, and we'll talk about this briefly as well, in the case of emergency, you shouldn't instantly jump to dissolving.
Yes.
There's a whole bunch of other things you can do first. You can do heat pack and massage, which is absolutely vital, and sometimes that can clear a VO, and I've seen it myself. So don't automatically just think, oh, dissolve, dissolve, dissolve. And also on that note, don't see something that you're not quite happy with and your first thing to do is just dissolve. Get advice, make sure it is definitely a VO, then do all of the other things first and then dissolve after, because you do not want to be risking any chances of anaphylaxis, because like I said, that is the single worst thing. But let's quickly talk about dilution. So this is the way I look at dilution. Based upon the vast experience I have with fixing occlusion, I think that hyaluronidase is more potent than people give it credit for, and I'm more than happy to mix it with 10 ml for emergency or for elective. So in an emergency, I actually quite often use 10 ml because I prefer the fact that I get a lot more spread with it and a lot more longevity of it hanging around a specific area. And even actually, if I have 4 people in on a day that are being dissolved electively, I'm quite happy to mix it with 10 ml, decant it into 4 2.5 ml syringes and use 2.5 ml on each person. But I'm equally happy to mix one with 2.5 ml or even 1 ml and use that, depending 100%. On what I'm doing. The point really is, without getting too kind of deep into it, because this is very much subjective in terms of what your beliefs are of how much you should dilute, I'm not that fussed about it.
Yep, I agree 100%. And I've seen cases where I've dissolved with 2.5 ml and I've also dissolved when I've diluted it with 5 ml, and I have not had issues with the 2.5 in comparison to the 5.
No, and in fact every single VO that I've fixed probably in the last 2 years, I've diluted with 10 ml and been more successful than the people that have attempted it before me that have typically done less. And I'm not saying that's the reason, because it's not. The main reason is outside of that, but the point is that it's not going to have a negative effect.
No.
So don't be afraid to dilute your hyaluronidase down further than you may imagine, because I've got significant amounts of positive evidence that mixing it with 10 ml is absolutely fine, but that also is combined with a lot of knowledge and experience. So don't just think, oh, I mix it with 10 ml and it's automatically going to fix a VO, but also don't think that it won't, because it will. And if you, like I said, when I have 4 dissolving clients in a day, I will quite often mix 10 ml, although 10 ml is my limit.
Yes.
Yeah, and 2.5 ml is my go-to for how much I put in to dissolve, for example, lips or cheeks or whatever it might be, and that's split between the two.
Yes.
So 1.25, 1.25, 1.25, 1.25. But that could be a combination of either 1500 IUs mixed with 2.5 directly, or just 2.5 ml of a 10 ml dilution that's been mixed with 1500 IU. I hope that makes sense. So yeah, dilution is just not as much of a big subject as people probably make it out to be. So what else have we got around dissolving?
Well, just quickly
general?
on what you said about if there is a vascular occlusion, don't just jump to dissolving. You said heat pack and massage.
Yeah.
There's aspirin, there's Viagra, there's the continual kind of, well, I'm talking about lips here, but on the face it's slightly different. Doing that for about an hour with continual capillary refill timings, checking that area, and then you can think about dissolving. Because I think, like we spoke about on our previous podcast, is I think people think that with vascular occlusion, because time is important, but we're talking kind of hours here.
Yeah.
It's not a minute by minute. So if you spend 15-20 minutes with heat pack massage, and then you spend a couple of time giving them the aspirin.
Sorry.
No, you're okay.
I just want a drink.
Giving them Viagra, giving them aspirin, and you actually wait for that to work, you wait for that to kick in, and you continue that cycle. Because like Adam said, the lesser of the two evils would be an occlusion potentially than than anaphylaxis.
Yeah, for sure.
Yeah.
And then this as well, we'll end on this because this is a bit more light-hearted, if you like, but there are a significant amount of people, whether they be clients or practitioners or anyone else, that believe that hyaluronidase takes away more than just hyaluronic acid, which, by the way, is factually untrue and proven and documented. But let me explain why people typically think that is. Obviously, because people gossip and talk and things get distorted with that Chinese whispers.
Yes.
However, the main reason for it is this. If I, for example, like Annie had her lips done probably for the first time, 6-7 years ago, something like that. So during this time, I mean, Annie's young, so she hasn't really aged. But say, for example, Annie was like the age she is now. So she's 20, say you're 25 and you have lip filler now, and then in 7 years we dissolve it. Well, during that time, you've lost volume. So what that means is, to you, you would have your lips dissolved and then think, oh, it's taken away more than the filler because they're smaller than they were when I first did them. However, that's sheerly down to the fact that you have lost volume during that time. So obviously, when you then have them taken out, they're smaller than they were when you had them done. Plus, you've got used to having them bigger in the first place, so they look double smaller. But it is not true that they dissolve fat, tissue, or any other item. The enzyme is specifically dedicated to dissolving hyaluronidase. Hyaluronic acid. Yes. And in addition to that, a couple of little things. If you were to get, for example, like a little tray or a petri dish or something, and you put filler on it and you squirt hyaluronidase over the top, it does not just melt it like an ice cream in front of the fire.
No.
It doesn't do that. You must agitate it. And this is where the massage becomes equally as important as putting the product in itself. I've seen so many people where they're like, I dissolved this lady's lips and they're still there. And I'm like, did you massage? And they're like, no, I put the dissolver in. You have to massage, you have to agitate. It is a required part of it. So don't dismiss that element of it. Spraying it in doesn't do what it needs to do. Also, be specific, be precise with the way you're doing it. Don't just spray and pray. Put things where it needs to be, and then work outwards from there. Like if you're just gonna go in a VO like most people do, and I literally call it spray and pray. They just spray, pray. That is not how you fix a VO. You have to be accurate, you have to be precise. And then to end on one more myth. Do you know what I'm gonna say about hyaluronidase?
No.
Okay.
Inform me.
The biggest myth about dissolving and hyaluronidase in general, probably outside of pain, because that is definitely the biggest one, is that you have to put the product inside the blood vessel in order to dissolve the VO. You do not. The whole magical ability and purpose of hyaluronidase is that it can permeate, like we spoke about earlier with the sperm and the egg. It can get through the wall. So hyaluronidase can permeate. And when I say permeate, I mean pass through. So if this, for example, is a muscle, the hyaluronidase can get through. If this is a blood vessel, the hyaluronidase can get through. It can permeate an object, much like the egg. So if you have an occlusion, for example, or even if you're dissolving filler, you don't necessarily have to be on the right plane in terms of the depth with the muscle in between. You also do not have to be the tip of the needle does not have to be inside the blood vessel with the blockage. It simply has to be close by, but it does have to be agitated into it.
Yes.
Yeah, and so many people I meet, even massively experienced practitioners, think that to dissolve a VO, you physically got to get the tip of that needle, put it into the artery that you occluded, and then flush it. That is not how it works at all. So please, please, please do remember that. If you want to know more details about that, maybe we'll talk about that more in more detail at another point. But those are the two big myths about hyaluronidase.
Yes.
Busted.
Busted.
So I hope you guys enjoyed that episode. If you've got any questions or anything, like I said at the beginning, please do drop us a message however you want, and we'll include them in the next episode. But massive thank you to Annie.
Massive thank you to Adam.
And thank you to you guys for watching or listening. We appreciate it, and we'll see you in the next one.
Bye.